Our topic today is sedation and general anesthesia. In other words, what you do when all of the behavioral guidance techniques we talked about last time just don't work well enough so that you can provide treatment for a patient that has combative behaviors or resistant behaviors. Let's start with a platitude. All generalizations are bad. And what I mean by this is what I'm saying today is mostly true. There will be exceptions. So remember, we do not paint everyone with the same brush or everyone in the group with the same brush, but for the most part, everything I'm going to tell you is based on clinical experience and supported by the literature as much as possible. So let's start out with what we're all looking for. This is the magic pill. And what the magic pill does is it takes an uncooperative patient and makes them cooperative for dental care. Well, the problem is there is no magic pill. So when I hear anyone, and this could be a caregiver, a family member, even another dentist with different types of experience say, why don't you just sedate them or why don't you just put them to sleep? I know they have no clue what they're talking about because there is no just in just sedate them. It's a very complicated process and it's not always possible. So if we take a step back and look at oral sedation in dentistry, it wasn't that long ago that many offices were advertising what they called sleep dentistry. This is obviously attractive to a patient who has dental phobia, for instance, or even a patient who just doesn't like to sit for long procedures. But it was soon realized that sleep dentistry is really a misnomer, and there were some ethical problems advertising things this way because patients are not actually asleep. They may have a mild sedative on board. So then we started talking about sedation dentistry. Sedation dentistry is a better term. You can see these are the supposed indications. If a patient has difficulty getting numb, I don't know what that really means, but I've heard it from a lot of patients. So sedation dentistry definitely does have a place. It's a very small place in general dentistry, but it does have a place, and some people do benefit from it. Well, what about people with special needs? Benzodiazepines can be used somewhat effectively if the issue is anxiety. Remember from the last module that frequently the issue is not anxiety. It can be fear, it can be tactile defensiveness, it can be stimulus avoidance, it can be, that the patient's exhibiting agitation. But if the patient truly has anxiety, benzodiazepines can be somewhat effective. And historically, Valium or diazepam was the benzodiazepine of choice. In more recent years, lorazepam or triazolam are the medications that are typically used, and those are the typical dosages. There are old regimens that people used to use quite frequently, where a patient would be given either 5 or 10 milligrams of diazepam at bedtime, and then 5 or 10 milligrams of diazepam 1 hour before the appointment. And again, if the issue was anxiety, this could be somewhat effective, but mostly it just made a person sort of groggy and not cooperative. There are problems. The first problem is, as you've already figured out, that the issue frequently is something other than anxiety. Maybe the patient does not have anxiety, and the anxiety is not what's driving their behavior. Maybe they just don't want you to be there. Maybe they just don't like what's going on, and they don't have the social filters in place that many patients have, so they are not going to behave themselves because they don't want to behave themselves. The other problem is patients with intellectual and developmental disabilities are frequently already taking anxiolytic agents chronically. Many patients take maybe 1 or 2 milligrams of lorazepam every day. So you would need doses that are very high and very unsafe in order to use additional benzodiazepines to combat anxiety in this case. So if we go to the literature, this is my friend Nancy Doherty. For individuals on a daily regimen of psychotropic meds, the effectiveness of anti-anxiety meds may be considerably compromised. In other words, they're taking so many medications that adding one more medication isn't going to make much of a difference. And in order to use a drug effectively, you would need massive and unsafe doses. Here's the other thing. Pediatric medications do not work well on adults with developmental disabilities. Chloral hydrate is as it says here, non-barbiturate, non-cumulative, tasteless, odorless. It's a nice medication. It's used for pediatric sedation sometimes, and it used to be used to sedate adults with special needs. So in addition to the 5 or 10 milligrams of Valium at the hour of sleep and 5 or 10 milligrams of Valium an hour before the appointment, patients would frequently be given chloral hydrate immediately before the appointment because it's fast and short acting. But remember, once again, we are not treating overgrown children. We are treating adults with adult life experiences and adult physiology. So what tended to happen with chloral hydrate is the patient would be a little bit groggy and they would appear like they might be cooperative, but they wouldn't be. As soon as they were stimulated, meaning you tried to do anything, the patient would be completely uncooperative, and then they would go back to their home or back to the group home, and they would sleep and sleep and sleep and sleep because they had all this medication on board. So all it did was make the patient no more cooperative for dentistry, but less cooperative and difficult to manage for the rest of the day. So this really was not particularly effective. One of my pearls of wisdom: there is no agent that can be given orally in safe doses to make an uncooperative person with developmental disabilities cooperative. However, there will be exceptions that prove the rule. We're getting away from it now, but there used to be patients who had a standing order for some sort of a sedative agent every time they had a medical appointment or a dental appointment. And